Hello, everyone. Good morning, afternoon, evening, wherever you are on planet Earth. Welcome to Conversations in Planetary Health. I'm Dr. Renzo Guinto, Associate Professor and lead of the Planetary Health Initiative here at the SingHealth Duke-NUS Global Health Institute here in Singapore. Again, welcome and thank you for joining us. Thank you to our audience here joining us in person, but also thank you to our friends who are joining via Zoom. For those who are attending our conversations for the first time, this series explores various topics at the nexus of our health, the health of people, and the health of the planet. Today, we are facing a wide range of environmental challenges, threats, from climate change to pollution, to air, water, and land, to biodiversity loss. And all of these problems are already affecting our health. And so in this series, we examine many of these challenges, but also we try to find the solutions to these problems. And that's why we have guests from around the world who visit us here in Singapore. And for an hour, we engage in a meaningful conversation, both inside this room, but also with our friends joining in Zoom. Today, we have a special guest joining us coming from the University of Cambridge. We actually met a few months ago there. And now it's her turn to visit us here in Singapore. Later on, she will be telling us a bit about why she's in town, what she's working on. As you have seen in the poster, we're going to talk about research, conducting research in this exciting new space at the intersection between diet, physical activity, our health, population health, and climate change. With us today is the co-director of the Global Diet and Activity Research Network. She's also a senior research associate at the University of Cambridge, originally from New Zealand, so not very far, but now she's based in the other side, or on the other side of the world. So we're very grateful that she can join us today to share her knowledge and experience and her expertise and scholarship. And hopefully later on, we can have a vigorous, dynamic conversation with our guest. So please, I want to remind our participants, both in person and via Zoom, please prepare your questions, because later on we will have an open forum, an open discussion. Just a kind reminder that this session is recorded, because we want to make sure that those who cannot join us synchronously can access the recording after this event. So without further ado, let's give a warm welcome to our friend, Dr. Louise Foley. Thank you for joining us.
Thank you so much for that lovely introduction. Let me just share my slides. Can everyone hear me online? I've got a slightly quieter voice than Renzo.
People are giving their hearts, sending their hearts to you, so they can hear you loud and clear.
Okay. Thank you so much. I wanted to start just by giving a quick introduction to our research consortium. So this is a Global Diet and Activity Research Network, or GDAR. Okay, so that's us. So I wanted to start this. Let me just see if I can fix the bars on my screen.
Yep, I think it's behind your PowerPoint.
Okay.
So let's unshare first.
Just a
So
moment.
we'll just fix the screen
I think
very
it's
quickly,
this.
or maybe maybe there's another. Just close all the windows.
Okay.
I'll remove it. There's a way to call
I do not know.
because there might be a window. That's all.
Okay, just. Okay, sorry for the delay, everyone.
So while we're waiting, we're just trying to fix the screen. I can see that we have more participants coming in. Thank you for joining us. And again, please reserve your questions for the second half of our session. I guess it should work.
Let's try again.
Yep. Okay.
Let's look this one. No, it looks worse.
Okay.
It's my.
Maybe it will disappear later. Yeah.
Okay.
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 It should work. Yep.
Looks slightly better. Okay. Okay. Let me continue. I think at least you can get the gist of the slide. So I wanted to start this talk by talking about the concept of a syndemic, which might be familiar to some of the people in this room. So this describes a sort of complex interplay of conditions and risks that drive threats to population and planetary health. And in low and middle income settings, in low and middle income settings, low and middle income countries, we see that rapid urbanization coupled with environments that tend to not be very supportive for healthy diets or active lifestyles and climate change. We see these forces intersecting to drive accelerating rates of non-communicable diseases or NCDs. And for example, in Africa, NCDs now outstrip HIV/AIDS as the leading cause of death. And global health is an applied science. So we want to unpick this complexity. We want to be outward looking. We want to be solution focused. But we find ourselves sometimes needing to chart a slightly perilous course between competing needs and tensions. We want to produce evidence that contributes to scientific knowledge, but we also want to drive real change in population and planetary health. So as academics, we need to demonstrate that we've conducted our research with rigor. So global health typically looks at phenomena that transcend national boundaries. So in our field, rigor looks like harmonization. It looks like the replication of study procedures precisely across many different sites, enabling cross-site, cross-city, cross-country comparison. And it means using tools for which there is sort of established precedent around their reliability and validity. But equally, I'd like to suggest that we need to conduct our research with meaning. So first and foremost, we need to do research that means something in the place in which it was conducted. And that means it has the potential to drive local change, and it can contribute to local dialogue and conversations on health and equity. But I think what I'd like to suggest is that neither of these refuges is actually a safe landing ground. So each in their own way could lead to shipwreck. And I want to talk through some of the work we've done in GEDA as sort of a worked example to propose an approach which involves charting your way through. So the work I'm describing today in this talk has also been published as a commentary that you might be interested to look at later. So I noticed in my spiel, I did say that I was going to talk about sort of different studies from African cities, from Kenya, from South Asia. But once I started putting my slides together, I hope you'll forgive me, I decided to do more of a deep dive into one piece of work. And I think hopefully that shows a nicer story of trying to navigate these tensions in global health research. So I'd like to focus on this study where we examined how features of the built and natural environment relevant to unhealthy diet, physical inactivity, and climate hazards were spatially distributed in 4 African cities. We also wanted to know how these features varied according to area level deprivation, which has implications for health inequalities. This study took place in 4 African cities. We had Yaoundé in Cameroon, Lagos in Nigeria, Cape Town in South Africa, and Soweto, which is a township on the periphery of Johannesburg in South Africa. And these are all big cities, populations ranging between 2 and 22 million. And as a first step in this process, we conducted workshops in each of our 4 cities, which you can see in these photos here. And we consulted with our partners in policy, in local government, in community organizations. And we use these workshops to prioritize relevant features of the built and natural environment in each site, to talk about sort of local concerns around particular aspects of climate change, and to identify appropriate measurement instruments and data sources for our sites. So from this, we designed a cross-sectional study, which examined features of the built environment, built and natural environment relevant to diet, physical activity, and climate. And we did this through primary data collection in the form of field audits, and we also compiled secondary data on climate hazards in small areas. So what are small areas? This was the kind of sampling strategy we used for this study. So a small area was something slightly different across each of our cities. But in all cities, this was a locally meaningful spatial delineation of a neighborhood. And we then sort of overlaid buildings and the street network across our small areas, and we audited 25% of the road network in each small area, which is a proportion that's considered adequate to give kind of an overall view of what that area looks like. And we wanted to explore possible inequities in the spatial distribution of environmental features. So we categorized each small area as being either higher or lower deprivation, and we had an approximately even mix of higher and lower across the 4 cities. And so in each of these small areas, we had the road network. We audited 25% of the road network in routes that were approximately 500 meters long. So one of the things that came out of our stakeholder consultation was we selected 2 data collection tools that we felt were most appropriate to our context. So the first of these is Maps Global. This is an audit tool that assesses attributes of the built environment relevant to physical activity. It's got 4 sections, which you can see here. And I've given you some examples of each of the sort of types of things assessed in each of these 4 sections. We also used EPOC. So this is another audit tool. This measures environmental determinants of heart health. Importantly for us, it includes assessment of food retail. It's got 5 sections, of which we use 4 in the current study. And again, I've given some examples of the types of things in each section. Then we compiled data on climatic hazards using open data sources were available, but we also relied on our stakeholder networks to collate data on, for example, air quality from local researchers. So this is urban heat island data overlaid on our small areas in Lagos. So overall, we audited more than 600 routes across our 4 cities. And we compiled data on urban heat islands, on rain, precipitation, and flooding, and on different indicators of air quality. So as I mentioned, we used open data where available, but we also used our stakeholder networks to source data. So I want to pause for a moment here and think, sort of talk through how we went about collecting high quality data that was comparable across cities, but also meaningful in the place in which it was collected. So we're still analysing data from the study. So I just want to zoom in on the MAPS Global data today, which, as you recall, looks at features of the built environment relevant to physical activity. So firstly, we found that training local auditors was essential for high quality data collection. And you can see photos from training sessions in each of our cities here. We tried not to change the tools too much because we wanted to maintain international comparability. However, we did invest a lot of time into making sense of the tools in our context. So let me give you an example. One hurdle that we encountered is the difficulty representing informality in audit tools which are intended to be globally applicable. So by informality here, I mean roads and housing developed outside of formal urban planning structures. So in Africa and on a global scale, informality is not unusual. And I think it needs to be part of the conversation on sustainable, healthy, equitable urban environments. So just to be clear, what you see in this photo is not a rural road. This is a street in Yaoundé, Cameroon, which is a city of more than 3 million people. But this question about traffic lanes from MAPS Global is much easier to answer for contexts that have paved roads. And similarly, the question about parking, this is geared towards places that have sort of formal and enforced regulatory structures around parking. I mean, I would ask here, is parking allowed? Well, by who? And if you're not allowed, people still may do it. So it's not so meaningful. It's not so meaningful in this context. And it's also very difficult for an auditor to answer this. Let me give you another example. When we were analysing our data, we noticed across the board that all of our routes scored very low on aesthetics. And I've given you some examples here of the types of questions that were asked in MAPS Global. But scoring aesthetics necessarily involves making a value judgment about what looks nice. And for MAPS Global, these related sort of predominantly to kind of Western ideals around tidiness and order. And these might not be appropriate in settings where informality is predominant. So I'm not trying to be critical of these global audit tools, because I think, especially in global health and global public health, these are a key tool in our toolbox to drive conversations that sort of transcend national boundaries. But I think we need to use them thoughtfully if they are to be effective, because we want data that is locally resonant as well as fostering these bigger sort of transnational conversations. Okay, so for the next sort of two aspects of work I'll describe, I just want to zoom into Soweto, which was one of our 4 cities. So it's got quite high population density, and as I've described, we audited 25% of the street network across 4 small areas of Soweto. So one of the things we started looking at is we wondered about the importance of who's looking when you audit environments. And I think actually this is a research question we didn't start out with, and it developed as we started wondering why every route was scoring so low on aesthetics. Because obviously making a judgment about what looks nice depends on who's looking at it and what they think looks nice. So in this first piece of work, we wanted to look at how familiarity with the local context influenced the reliability of conducting the field audits. And we had a set of raters with different levels of familiarity with the local context. So as I've discussed, our work was primarily based around in-person field audits of small areas, but virtual audits are seen as a kind of efficient method to also conduct field audits. And with Google Street View now offering sort of unprecedented global coverage, they are becoming much more popular as a means to audit areas without having to have boots on the ground, basically. So in this study, we virtually assessed using Google Street View a subset of our field audited routes in Soweto, and we compared the results of the virtual audits with the field audits. So we put out a call across GEDA for people to volunteer to be auditors, and we got 10 people who agreed, and they came from South Africa, Nigeria, Cameroon, the United States, and the United Kingdom. They all received the same standard training. We asked these auditors to code the same 7 routes, and then we looked at the inter-rater reliability. So we had 3 categories of familiarity. So we had a set of raters who didn't live or work in Soweto. We had a set of raters who worked in Soweto, and we had those with field familiarity both worked in Soweto and were the ones who conducted field audits in Soweto about 9 months earlier. So let me just orient you to this graph. So each row shows an item on Maps Global, with the inter-rater reliability displayed according to the categories of familiarity. So, excuse me. Lower scores indicate poor reliability, and higher scores indicate better reliability. So sort of being further to the right is good. So the green diamonds, the raters with no contextual familiarity. Yellow triangles, those who were familiar with the context but hadn't been in the field, and the blue circles were the people who both lived and worked in the area as well as had conducted the field audits. So overall, familiarity was associated with greater inter-rater reliability. Reliability tended to be better for features assessed on crossings or for counting shops and amenities, and very poor, as you might expect, when judging and coding aesthetics. But the differences were most marked between the highest and the lowest levels of familiarity. So you can see there's sort of more blue circles to the right, and there's more green diamonds to the left. So if you're interested in this work, we published this recently, so you could check that out. And this is sort of hot off the press from the last few weeks. So I just, again, want to zoom into Soweto and talk through our findings from Maps Global in the city. So as you recall, these are our 4 small areas. We field audited 25% of the road network in each small area. And as you also recall, Maps Global allows you to code both positive and negative features of the built environment relative to physical activity, with negative features being proposed to be not supportive of physical activity. So our key findings were that we found more negative environmental features in high deprivation areas compared to lower deprivation areas. But many of the features on Maps Global, particularly recreational facilities, cycling infrastructure, public transit stops, and amenities that help people cross the road, were simply absent on most of the routes in Soweto. So overall, we concluded that environments tended to be unsupportive for physical activity across all areas, but that higher deprivation areas exhibited more unsupportive elements. And we also noted the widespread absence in our context of many activity promoting features. So overall, these inequalities may contribute to reduced local opportunities for safe and appropriate physical activity. Okay, so what? We've got some valuable information about the health promoting potential of built environments, but we as scientists are not going to be the ones changing things on the ground. So what do we do now? And the answer is that we talk. So we have ongoing dialogue with our partners in the community and in local government. So I mentioned earlier, we had stakeholder workshops to set our research agenda, to prioritize our environmental features, and to discuss how we were going to measure them. But we went back to these people with our findings to sort of discuss how they could be put into practice. So these are just examples of 2 workshops that have taken place over the last couple of months. This one's in Johannesburg, this one is in Lagos. So let me just give you an example of the potential of our findings when talking to stakeholders. So here I'm showing you a small area, Parklands in Cape Town, and I've scored the routes and color-coded them according to the minimum and maximum scores that we found in Cape Town. And you can see there's some heterogeneity here. So some routes are green, some routes are red, some routes are in between. And this heterogeneity is important because these routes are different in important ways. So for example, the highest scoring routes in Parklands featured amenities, green spaces, public transport, and infrastructure to protect pedestrians. And particularly in an African setting, infrastructure that protects pedestrians is particularly important given very high rates of walking by necessity in Africa, coupled with a very high burden of road traffic injury. So these are important differences between these routes. So I think understanding the specific features of these high scoring routes gives us some ideas about clues to ways in which environments could be improved, which are clearly feasible locally because they are already taking place in some places. So they're sort of practical and politically feasible. And these are the types of things that we communicate with our partners when we discuss our findings. Okay, so I'd like to sum up. So just offer a few thoughts for our discussion. So as I hope I've shown, we want our research to be both rigorous and meaningful. But I think my point is that one can't come at the expense of the other. So let me just start with this first shipwreck. That's meaning, so rigor without meaning. So I think this is a common shipwreck in academia. It stems from an over-reliance on the idea that measuring things more precisely in more places in a more standardized way on a bigger scale will eventually sort of the right answer emerge. And I think this rests on a false assumption that there is a right answer. There is this sort of generalizable right answer that we can discover just by collecting more and more data. And it also assumes once we have the right answer, that will be appropriate everywhere or generalizable everywhere, which I don't believe to be true. But then I think we also encounter the second shipwreck, which is meaning without rigor. So I think this runs the risk of producing very hyperlocal answers, which miss the opportunity to tap into these bigger international conversations around healthy and sustainable built environments. And I mean, these really are issues on which every place needs to have their say. It also means that solutions from elsewhere might be overlooked in favor of those that are sort of more palatable or more salient to local decision makers. So my suggestion is that for future research, there's sort of a sweet spot here, which involves charting a course through. And the key features of this are firstly transparency. So transparency in some way, I think, replaces rigor and is more of an idea about trustworthiness of your research rather than particularly demonstrating it's past some sort of hurdle of rigor. So it's about showing your working, it's about describing the how, but also importantly, the why of your methods so that others can sort of thoughtfully replicate your work, because I do think that replication is important. Secondly, I think we as researchers need to show humility and understand what we can and cannot bring to the table. So we do applied research. We want to do research that is like practice facing, that answers important questions that decision makers have. and we can talk to these decision makers, and we should, but much of the action required for healthy and sustainable cities is outside of our sphere of control. So I think we need to see ourselves as scientists and as engaged citizens who need to collaborate. And finally, as well as kind of quantifying and describing relationships, we need a commitment to making sense of them with a diverse group of people. So I mean people from the area in which you collected the data, but I also mean a diverse set of people, not all of whom are scientists. Okay, so I'd just like to acknowledge the funders of our research. And I just wanted to show you, this is a slightly more informal video of our network. So I'll just quickly, I think, yeah, we've got time. I'll just quickly run through that now.
Mm-hmm.
We are the Global Diet and Activity Research Network, or GDAR. Our work is at the intersection of climate, cities and health, and we're interested in how cities that are growing rapidly can be designed to be healthier and more climate resilient. And we're particularly interested in generating evidence that informs the design and governance of cities to improve the ways we move and the food that we eat.
We're driven to find innovative solutions to tackle these complex urban health challenges.
We are made up of researchers from Brazil, Jamaica, Kenya, Cameroon, South Africa, Nigeria, and the United Kingdom.
We are a diverse group of epidemiologists, geographers, public health professionals, urban planners, health professionals, and anthropologists.
Most importantly, our research agenda has been and continues to be co-created with communities and policymakers through regular consultations.
We use a diverse range of methods. For example, auditing neighborhoods to understand how they support healthy diets and active living.
We engage communities to understand how they respond to the challenge of climate change. We analyze policy documents and work with policymakers to inform strategies to address urban health challenges.
Together, we are building more healthier and resilient cities for the future.
Connect with us to learn more.
Okay. Yes, thank you very much for your attention. I think we've got some time.
Yes, thank you so much, Lou. And that video is a testament that planetary health research can be fun too, right? And it's lovely to see our dear friend, my partner in crime in planetary health, Tolu Oni, walking the talk or bicycling, I think, right? Or while talking about this project. And again, thanks, Louis, for this presentation. I think we learned at least 4 dimensions from this presentation, and kind of mirroring back to you what I heard, and later on we'll hear from our participants both in person and Zoom what they heard from you, but also their difficult questions. But from my perspective, we heard about the project in itself, and I think we have at least one question here specifically about the project. 2, we heard some initial insights. We know this is an ongoing project, but some initial insights in relation to or related to this intersection of climate change, diet, physical activity, and our health. We heard some methodological innovations. Very interesting. We have a few questions on this aspect as well. And then you close your presentation with some reminders regarding our responsibility as researchers who need to balance both rigor and meaning. And in a way, what we heard is they're not polar opposites, and we have to choose one over the other. There are ways to really bring them together and make sure they're manifested in our work. I guess one question just to stimulate the conversation, and I want to encourage both our online audience, but also those who are in the room to start thinking about their questions. My question is, because there's a tendency to, simplify or be reductionist in our thinking, in our view, that it's rigorous when it's quantitative, and it brings meaning if there's a qualitative dimension to the research, right? And that's why now the mixed methods approach is becoming more and more popular. What do you say to that?
Well, that's a very good
remark.
first question.
Statement.
Thank you for the question. Yes, we see that a lot. This idea that quant sort of lays out what the relationship is, and then the qual is there to sort of explain it and sort of in a kind of secondary role to kind of add meat to the big quant finding. But I think that is a missed opportunity to conduct quantitative research that is meaningful in of itself. And I think it also puts qualitative research in this sort of secondary explanatory role, when actually I think qualitative research can have a primary role in explaining some things much better than quantitative research could.
It's a false dichotomy.
It is.
Right? And qualitative research, maybe oftentimes add the rigor.
Yes.
And then quantitative findings also provide meaning. So again, maybe we should try to dispel and be more proactive in dispelling this myth. And another question in relation to your project, and then I'll go to some questions here. I think we have some questions in the room as well. In a way, what you presented to us is drawing from your presentation, small area research, right? We're looking at streets, we're looking at small villages. But then there's this also conception or misconception that planetary health research must be grand, right? We're looking at entire ecosystems, entire regions of the world, even the health of the entire planet. Is it time to kind of remind our colleagues that local is also global and planetary?
I totally agree. I don't think it's out yet, but I did a podcast recently where I got asked this question. Yeah, global is just lots and lots of locals. We have to start at the local level. Yeah. I completely agree with that. Yes, and there is a temptation to do your sort of 16 country, and in the title of these manuscripts, it always says with like 50,000 participants, always the number of people.
Right.
The temptation to do that, but it's just, we should start at the local.
Yep.
Yeah.
And maybe that's also a call and a reminder to funders of research, right? To fund more local research or locally relevant, locally oriented research that will have, and that has, planetary relevance and significance.
Yeah. And I think this idea has traction, right? Because there's all this work around localization of the SDGs, for example.
Right.
Like you can have a broad, big agenda, but you have to ultimately localize it and make sense of it locally always. So I think that idea is gaining traction, but maybe
indeed the local is the main arena. Do we have questions from the room before I go to the questions from Zoom?
I do actually.
Maybe quick introduction.
Yes. Thanks, Lou. I'm May from here, a research fellow working with Renzo. I'm actually a geographer, so very excited to see your project. And then I do have one question. And also very interesting to see how you pick the 4 cities and then in Africa and whatnot, and come up with a conclusion of walkability. But I also was wondering if the concept of food desert, like the normally I came up with this concept when I took qualitative research back when I did my PhD in Canada. So in developed country, although you think that in developed country, but the food desert phenomenon happen a lot of time, especially in like low income neighborhood. So I was wondering if this concept also came across with your research, or like food availability was also part of the focus in addition to the walkability.
Yes-ish. I'm also quite interested in the food desert sort of landscape, because I think that became really popular some time ago, and it's definitely, you see that in like North America, this food desert phenomenon. But for example, in like Europe and the UK, it's been much more difficult to demonstrate that is really how food retail is laid out. I think the additional complication in some of the contexts where we're working is that there's a much more diversified food system beyond food retail. So, for example, in high-income countries, most people buy their food. That's the main way people get food. And so food retail is sort of where all the action is. And if there's a food desert, well, there's no other way people will get food. But, for example, we've done some work in Africa and in the Caribbean looking at food sources, and it's much, much more diverse in terms of food sharing, in terms of growing some of your own food, and sort of remittances between sort of families or bigger groups. So just because there's a retail food desert, that doesn't mean that there's no food, because people can procure food from a more diverse set of sources. And also, we didn't, even in the food retail sector, we didn't find really deserts per se. There was lots of places to get food, but it's more how much food was there, what type of food was it, and how much it cost. And particularly, we found some differences in fresh food availability between higher and lower deprivation areas. So it's not so much about a food desert, but about the quality and price of food.
Affordability.
Yes.
Yeah. You know, one term that came to my mind, you know, the McDonaldization. I hope no one from McDonald's is listening. McDonaldization and look, you know, here Lawsonization. We have lots of these convenience stores, right? And yes, they're widely available, but you're talking about it's not just the presence, but the quality, right?
Yes.
And in low and middle income countries, you also have this culture of like the kiosk, right? In the Philippines, we have this sari-sari store. You can buy everything, right? I'm sure in other places, Kenya, they have this concept of a small shop, right? Which are the vehicles for food, but also not communicable diseases. We need to also look into those establishments and, you know, where are they located? Right, in these places.
That is some work we are doing separate to this piece of work I've described. We have done some work looking at the small and informal food sector in different cities, and it's very complicated, I suppose. We did look at food retail around schools, and there are a lot of particularly in Johannesburg at primary schools. Outside the school gates, there are a huge number of informal vendors, and they're typically selling sweets, and sort of chips, crisps, or I don't know what they're called here. I would call them chips, but British people would call them crisps. But the people who ran these small stalls were typically the parents of children at the school, and they relied on this money for their livelihoods. So simply saying like these people shouldn't be here selling junk food to the children is not really a solution, because those children are relying on that money for their livelihood, for that family's livelihood. So yeah, I think that is also, you know, a sort of wicked problem, I suppose.
Because we're now talking about informal establishments, right? Whether it's food establishment or, you know, in my notes, you mentioned earlier, even the roads are informal because, you know, today there's a road, tomorrow there's none, or maybe they're still being constructed, or, you know, it's a living setting, right? It's not static. But maybe some of our tools, and maybe you can tell a bit about the tools. How are these tools incorporating the informality, but also the living nature? You know, because on, you know, this day the kiosk is there, tomorrow they're not going to show up. So how are they taken into account?
Not at all, I would say. The temporal dimension particularly, no. I mean, food environments in high-income settings tend to be very static because it's a shop that will be there for a period of probably years. We're not capturing food environment well, especially when it comes to like vendors with carts or people who kind of turn up and set up a store with like their surplus and then go away again at the end of the day. That is a topic that one of our PhD students in GDAR has been looking into, trying to capture that temporal dimension. Yes,
not just
because
spatial.
during rains and things, then they'll pack up, and you know, it's not just sort of time of day, or there's lots of different things that influence who will be where, selling what.
Brilliant. We have some questions from our online audience. Let me read some of them. If there's no public transport available, we were talking about informal ways of travel and connectivity, locals may have to walk more to get to places, and that would constitute more physical activity. Shouldn't that be rated as a positive feature? So basically, you're saying don't build the roads and the walkways so people will find their way to travel on foot. What's your take?
Yeah, that's a really interesting question. Let me refer to a systematic review on transport inequity in Africa that we published some years ago. So my background is a physical activity researcher, and particularly in the last few years have been focusing on active transport, with the idea this is sort of a universally good thing that everyone should be doing, walking, cycling, taking public transport so that they get their health promoting physical activity. So you can imagine my surprise as the lead on the systematic review when, after doing the review, we concluded that walking for transport might be one of the biggest drivers of gendered and socioeconomic inequity in Africa, because it is undertaken by people with no choice, particularly children walking very long distances to school, and the opportunity cost of having to spend that time doing so much walking really does outweigh the physical activity benefit that they gain from it. And so we concluded that actually reductions of walking for transport would be beneficial in a large segment of the population.
Right.
However, there is kind of an emerging in Africa, an emerging middle class for whom car ownership has now become possible. And I think there are still large segments of the population that would benefit from either not moving to the private vehicle or for doing more walking for transport, but a very large segment of the population, particularly women and girls and lower socioeconomic groups, would benefit from doing less walking. So I think again that shows the importance of the local,
but also looking at this issue from a more holistic standpoint, right?
Yes.
Because yes, physical activity is important, but also how does this, for example, transport system, this walk capability system that we're creating, is it exacerbating economic and gender inequalities? What's the effect on mental health? I wonder if they're also looking at, are people more irritable because they're still looking for that road that still doesn't exist, right?
Yes. One of our colleagues in GDAR, Vicky Lambert, who's a professor in Cape Town, she's written about this idea of physical activity security, which I actually, in parallel to the idea of food security, like having enough sort of safe, nutritious, adequate, affordable amounts of food. So she's sort of looked at it in parallel. Physical activity is about having, safe and appropriate access to physical activity. And I think the safety thing, particularly in Africa, is an issue, like safety from road traffic injury in particular.
Interesting concept. If we have a right to food security and right to water security, maybe it's time for us to also, advocate for the right to safe and secure physical activity.
Yes.
Yep.
Yeah,
And
that's
equitable and just.
Yes.
We have another question here from Deepak, who is an epidemiologist from Kerala, India. We have participants from overseas. I have just started working in spatial and environmental health recently, spatial epidemiology. Fantastic presentation. When doing geospatial work, how do you account for this? Let me just read. It is very interesting to see your examples, especially the slide where you ask the question if the road is motorable and parking was possible. So building on our ongoing discussions on the informal, settings. When doing geospatial work, how do you account for this diversity not captured on OSM or Google Maps? What are some resources to train more in these techniques?
So the first question, how do you account for this diversity not captured? That is a fundamental limitation of relying in many cases on this big open data, which we know particularly from our local collaborators is incomplete. And it's not incomplete randomly either. It tends to be less complete in more deprived areas. So that's a major limitation of the work that we do, which I don't think I have an answer for. But it's, I think, thank you for the question, because I think it's something really important to point out. And some resources to train more. I should put you in touch with our resident geographer, although maybe other geographers might wish to chip in. I know that Google actually has some fantastic resources on using Google Earth Engine, I think it's called, which we've found really valuable. So you could check those out. I unfortunately am not a geographer, so I might be slightly limited, but you'd be welcome to contact me and I could pass that question on.
And these technologies are rapidly evolving and continuously being refined and improved. We have another question.
Yeah. Thank you so much for your presentation. It's so interesting to see like examples of the limitations that you're coming across, but also the ways that you work around those. You were talking about rigor and meaning in the context of like local and global research, but I'm curious to hear if there's because you're doing research across like diet and physical activity, but also climate, if those different disciplines have different I guess things that they're looking for rigor and meaning, and if that's shaped the work that you have done.
Yes. Yes. Like doing interdisciplinary research is very like, I don't want to say trendy, that I'm not trying to be sort of sarcastic about it. It's very popular right now, and I think I really believe it is a great way to work. But inevitably you run into problems because different disciplines have different ideas about what is rigorous. And sometimes those ideas cannot be resolved. Like they simply come from paradigms of knowledge that are not compatible, and so they just have to sort of uncomfortably live with each other. Yeah, I think really the answer comes back to transparency, because transparency allows others to decide on your rigor. Yeah. And it also opens up a conversation of like, oh, why didn't you do it this way? Because, in the climate field, you should have done this with your PM 2.5 or something like that. So you're showing you're working, you're putting it out there to be examined. But yeah, in terms of all coming up with the same agreement of sort of what is rigor, that's very difficult. Yeah.
And I guess you mentioned one word towards the end of your presentation, humility, right? Being open to different disciplinary traditions. This morning we were just having a conversation about, this new field of climate and health. And the two sides, climate and health, have lots to learn from one another, right? In the climate side, we have mechanisms like the Intergovernmental Panel on Climate Change. That's how we curate evidence in the climate side, and we need to learn more from them. On the other hand, the climate sector has lots to learn from how we do it in health. Cochrane evidence synthesis. We have our own method. So I think there's a lot of opportunity for cross learning and joining forces.
Yes.
Yep. I think we have more questions. Let's collect the two questions together, right?
Yes.
Your name?
My name is Tino. I'm also with SDGHI and the Education Core. Thank you for your presentation. I've always wondered how can physical activity be encouraged in Africa, and how we can shape the environment to do so. But I think at least coming from Africa and having lived in Singapore, you mentioned that physical activity, security, and I think my question is, how does one balance shaping the environment? You do the research in the environment, and I suspect there's a hope for a change to better the environment, to incorporate physical change. But then how I imagine that there needs to be a complementary encouragement through the people themselves. Because I look at Singapore, I would say Singapore probably has the greatest physical activity security, environment,
yes,
and great, transport system, but you can also walk if you want to, but a lot of people would choose to take the MRT.
Very good.
So,
Yeah.
like how do you balance?
So do you mean you can work on changing the environment, but you also need to change the people?
Yeah.
So there needs to be population behavior change running alongside. I mean, again, like a great question I probably don't have a good answer for, but I do think there is something in creating environments that facilitate behavior, then starts to normalize that behavior. I'm new to Singapore and I went out running 6 a.m. in the pitch dark. Had no concern whatsoever. I mean, even in the UK, I don't think I would do that. And there were loads of people out running and I didn't think twice about it. And you start to normalize, it's sort of a chicken and egg problem. What comes first, making the infrastructure that facilitates safe and, appropriate physical activity, or trying to convince people it's a good idea, which will also drive decision making around that as well, because that will drive political will, because they will want to do the things that their constituents are asking. I think the answer is both simultaneously, but starting is very difficult.
It takes two to tango, as they say,
it
right?
certainly takes two to tango.
And then I guess for the demand side, from the perspective of the population, you need the educational system to facilitate that. You need the role of the media cannot be underestimated. So I think it's a collection of interventions that need to be done while we are building the walkways and ensuring that there are no food deserts and access to healthier food. Maybe let's have the last question.
Yeah, actually, super quickly on that, I think there was the documentary of Blue Zones, or where
Blue Zones, yes.
live. And Singapore was just named as like
one of
the 6th artificial blue zone, which was really interesting because the original researcher had 5 natural zones and he decided Singapore was a 6th. It's really interesting, and there's lots of people who are like, what is that, but I think I really appreciated especially some of that discussion going back to the qualitative is not less or a subset, because I think when you talked about the temporal aspect of parts leaving, that's just very like anthropological study of meaning to food to,
and we have done some like ethnography, like following along food vendors throughout the day.
The importance of
that will tell you more than trying to code them
Absolutely.
at a particular time of day.
For sure.
So it's
my question was kind of building off a little bit of hers actually, which is I guess this is beyond your paper, but I'm curious maybe just to share just a little bit about how you mentioned when you were bringing this to policymakers, and we've talked about the meaning of these new methods. I'm just a little bit curious about how they received it, meaning when you brought that graph with green lines of high value places, or the red lines with less helpful infrastructure, and kind of how those policymakers responded to not just the data itself, but the way you were presenting it. So what your talk was about, the rigor of it. Because one thing I always tend to ask is like, if that would have been good for us, and going back to your question of like, if those red lines could have been green, why weren't they already? Like, what's been holding them back? And maybe how much did it change for them? You don't have to go through everything, but like, what did it kind of change for those policymakers?
I guess the first thing to say is that it's our partners who have fostered this dialogue in their sites, like over 8 years, I think we've been going now. And so it's not, I always feel like when I present this, like it's not me talking to these people, because who am I really to talk to them? Like it's our partners who have fostered these relationships over a very long period of time. So the first thing I would say is that talking with communities and decision makers requires a commitment of a very long period of time and building of trust. And that really can't be done by like the person from Cambridge flying in to tell them about their own place, that's really kind of a silly idea. and so we've worked a lot about trying to sustain these relationships. You asked about how they kind of take this information in. It differs, I think, across our different cities, because we work in South America, in the Caribbean, in Africa, and sort of the conventions of how you have dialogue differ across those places. But I will say that people really like looking at maps. Like everywhere. They would be pleased to know as a geographer. Like people find visually seeing their place is really useful. And you said, like, why is that red or red, and why is that green and green? Like these are things we can look at, and our geographer on the project has made these like interactive shiny maps where we can, like, well, why is that red? Let me click on it and tell you why it's red, and how could it be green? Well, let me click on that green one and let's see what's there. So people have enjoyed interacting with our maps.
I guess it helps them form new connections, maybe ways of thinking about their own place.
Yeah, I think so. And I think we've really, I don't know, we've always succeeded, but we have at least always tried really hard to make sure it's a two-way dialogue. And that what we're not doing is turning up to like tell them what we found. But what we're doing is turning up to ask them what they want to know, and hopefully we can, you know, can have some conversation on that.
Okay. Well, you know, the last question that I wanted to ask was also from our online audience, but I think we already answered it. If we're going to use your tools here in Singapore, you've been here in Singapore for the past 2 weeks, how would Singapore fare, right? And I guess the conclusion was it may be the place with the highest level of physical activity security. Maybe you have additional thoughts as concluding remarks.
Thank you very much. Yes. Well, if we were to use, for example, Maps Global in this context, the first thing I think we'd want to do is go out and walk the streets with someone who lives in Singapore and talk about, you know, here's all the items, you know, what does a pharmacy look like, and what does a bus stop look like, and work through all the different items together to get an idea. But I suspect, whereas we found a huge number of zeros in our work in African cities where, you know, things weren't present, particularly like private recreational facilities, somehow I don't think there'd be quite so many zeros in Singapore. So I don't know that it would be easier. I think we'd have to approach it just as thoughtfully with local people as we have done in other places. But it's certainly a very different environment. Yes, the physical activity security is noticeable.
Brilliant. But we need to do first the research before, rather than make your crystal ball diagnosis, right? Well, I guess that's a great place to end. Thank you very much, Louise, for joining us and for sharing your expertise. Perhaps we can give her a big round of applause. And of course, thanks to our participants, both online and in person. And I just want to remind our participants, our audience, that this August is we have 2 more episodes of Conversations in Planetary Health. Join us on August 19. We'll be talking about the future of humanitarianism in the era of polycrisis. And then on August 21, we will be learning about how to incorporate environmental sustainability in health technology assessments. So thank you very much for joining us, and stay safe always. Bye.